I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and peri-menopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. Hey, this is Dr. Fiona Lovely and the Not Your Mother's Menopause podcast. And I have a really cool interview for you today. Recently, I sat down with Susan Salenger, who is the author of a book called Sidelined. And she and I had a really interesting conversation about women's health and essentially the common decisions women make that undermine our health and our health care. Woof! This is a great conversation. And, when I was reading this book, I think I do a pretty good job of asking for what I need. And there was some really great tips in here. And I found myself in a situation where I was able to ask for better help. And I thought, this is fascinating. For those of us that are informed about women's health, you would think that we would do it right all the time, but that is simply not the case. So I'm going to encourage you to pick up a copy of Susan's book called Sidelined. Susan Salenger, again, is her name. Susan was born and raised in Los Angeles. She attended UCLA to study English. After graduation, she worked alongside her husband Fred for 25 years in their production company, Salenger Films, which produced corporate training and development films distributed worldwide. Today, Susan is 80 and she lives in Northern California. But let me tell you something. Go take a look at her on social media. She does not look like she's 80. Girlfriend is doing all the things right. Susan Salenger is the author and researcher behind Sidelined, How Women Manage and Mismanage Their Health. Sidelined examines the many ways in which some women manage and sometimes mismanage their health care. Oh my God, I'm so excited to share this one with you. Please go in and have a listen. And I just want to remind you that if you enjoy this format, you may also enjoy our video format interviews. They're all available on our Patreon page, which is patreon.com/Dr. Fiona Lovely, which I will link in the show notes. And a further reminder, pop over to my website, which is drlovely.com, to sign up for our newsletter. And again, super excited about this interview. Please enjoy. Take notes, listen with an open heart, and let me know if I can bring you something new and exciting. Now, onto the interview. But first, a word from our sponsor. Now, I'm sure you've heard of AG1 or Athletic Greens, not just on this podcast. There's good reason for it. It's a comprehensive all-in-one nutritional powder that helps fill the gaps in your diet, essentially providing some nutritional insurance, if you will, on a daily basis, specifically supporting immunity, energy, recovery, and gut health. It has 75 highly absorbable vitamins and minerals, high-quality whole food sourced ingredients, including adaptogenic herbs, probiotics, prebiotics, and medicinal mushrooms. It comes straight to your home, and if you order through our specific podcast link, which is athleticgreens.com/Fiona Lovely, I'll leave it in the show notes for you. Athletic Greens will include for free 5 free travel packs and a 1-year supply of liquid vitamin D3 K2. Check them out. Hello, everybody. This is Dr. Fiona Lovely and the Not Your Mother's Menopause podcast. And I'm thrilled today to be joined by Susan Salenger, who has written a beautiful book that I have just finished reading, and I can't wait to go back and read again. The book is called Sidelined: How Women Manage and Mismanage Their Health. And I'm excited to get started my conversation here with Susan, but I thought I'd read a little bit of a blurb about this book. So Susan explores in this book how women often hesitate to call the doctor when we don't feel well. And we worry that the doctor visit will take time away from our families or our work. We hesitate to ask doctors the necessary questions and don't always comply with the doctor's instructions. Susan's research reveals how conflicted many women are about the medical decisions they ultimately make. Again, a fascinating read. I couldn't recommend it more highly. So, Susan, welcome to the podcast.
Thank you so much. And thank you for having me.
Absolutely. Well, tell me, how did you find yourself writing this book? How did you get there?
Well, it's kind of a saga, which I'll try to make a long story short. But many, many years ago, I agreed to have some exploratory surgery that I was positive I didn't need. I had recently changed medications, and with the new medication, I just started experiencing some vaginal bleeding. And the doctor was afraid I think he was afraid of ovarian cancer, and I was almost positive that it was the medication. But so we ran a bunch of tests, and what happened is I got frightened, he got frightened because they couldn't find anything. So he said, we better, go in and see what's going on in there. And I knew it was the wrong thing to do, but not only did I agree to it, but I insisted it be done sooner rather than later. And so, okay, they went in, they found nothing. I went back on the old medication and, lived healthily ever after. But that was years ago, and I had little kids and I was working, so life goes on. And then when I retired, which lasted maybe 12 seconds, it was the wrong decision for me. I have too much energy. So I went back to school and took some anthropology classes. And for a term project, I interviewed women that had had hysterectomies. I'm not quite sure how I landed there, but I did. And they too many of them had agreed to the surgery, even though they weren't sure that they needed it. So of course that triggered my memory. And I began to wonder, how as women do we make our medical decisions? So I interviewed about, 50 or 60, I don't know, a lot of women, and found that many of them had also agreed to medical procedures, medications, whatever, that they really didn't want. And I began to do a lot of research, and I looked at all of these women that I interviewed had different diseases. I did that on purpose. And yet I found five or six things that they had in common, behaviors that they had in common. And I thought, I got to write a book about this. I learned in anthropology, there's some wonderful medical information for women, but academics write for each other. So it's really not out there in the public sphere. And I thought, I got to help get it out there. So that's kind of a roundabout way that, I got into the book.
I love it. And I love what you just said. Academics write for each other. That's so true. Because the average person has no interest in trying to wade through medical research.
Right.
So we're left with goofy folks like you and me to try to be the filter between the medical research and what the tidbits, the tactical things that we can actually do to help. Which actually reminds me, I made myself a note. I wanted to tell you, I love the way you end each chapter with what we can do about it section.
Thank you. That took work. It all did, but that was hard.
Yes. And for me, I love the tactical bits. I love, for the podcast, I always end with a list when it's just me recording about, whatever topic we're talking about. I always end with a list of, these are the things you can do right now, because information's all fine and dandy, but it's action is where things make the difference.
Right. And there are a lot of things we can do to better manage our own health. And I think that, it's an important part of the book. You're absolutely right. And thank you for that.
Yeah. And, I have to say, I've been in women's healthcare now 20 years. I feel like I've seen it all. And even though I'm the expert, I'm doing air quotes here, I'm
Right.
the expert. I read the first chapter. There are 6 things that hold women back. Not to
Right.
spoil it,
Right.
but there are 6 things. I read the first one. I went, oh shit, I'm doing this too.
Of course. We all do. We all
Yes.
do.
So I literally had a conversation with my husband, and I'm like, this is what I need. I've not been telling you how much I need to get better sleep and how you can help me with that. And what surprised me was how, even though he's amazing supportive, I'm not surprised that he was supportive, but we were able to have a conversation, actually do some new things that we hadn't done
Oh,
before.
I'm so glad. I'm so glad to hear that. That makes me so happy.
And it's true. And so I encourage my listeners to pick up this book, because as you are reading through these chapters, you will see and hear yourself so many times. And you will also be amazed at how shocking your behavior is when you see it through that lens, that mirror, right? We don't realize it. And actually, as I was reading Sidelined, I was struck by how shame and guilt play a role in how women access healthcare, play a massive, massive
Right.
role.
Right.
And I want to ask you about that, but I'm going to read a quote from page 46 first. So you say, sadly, the tendency to view illness as punishment for past behavior is common. You go on in the next page to say, we've been conditioned as women for thousands of years to think something is inherently wrong with us.
Right.
So talk
Right.
to us about that, please.
Oh, that's actually going to be part of my next book. Let's see, where do I begin? I'll start with a quick story. I put together a couple of focus groups, mostly because I wanted some geographical diversity. I had the information I needed, but I didn't have it from different parts of the country, and I thought that was a problem. So what I learned from these groups had nothing to do with my plans. I mean, the best laid plans, etc. But most of the women in the 2 groups, in each group, in the 2 groups I put together, had never talked with their illness with anybody else other than their doctor. And they said they were so ashamed of being ill. And that really just blew me away. Because, well, first of all, I don't do that when I'm sick. The whole world knows. There's not a quiet bone in my body. But I was really just so amazed. And it turned out, and then when I went back through my notes with the women I had actually interviewed as well, so many of them blamed their illness on stress. And they thought that their illness they got sick because they weren't managing their stress. They just couldn't manage their lives. And that's what made them ill. So when they did become ill, they felt it was almost like a news flash, a public acknowledgement that, oh, look, this woman can't manage her life. Look how sick she is. We just tend to blame ourselves. And it has such a long medical history. And what also is fascinating about the medical history part of it is it transcends cultures. Women have just been denigrated and dismissed really universally. The Dutch called having daughters like a cellar full of sour beer, and the Chinese called daughters maggots in the rice. I mean, this is not a complimentary thing. And that did surprise me. I knew, of course, that in the medical system today, women are misdiagnosed and tend to be misdiagnosed more than men. But I didn't know that women were denigrated, the world over. That surprised me.
It turns out for centuries.
Yes.
Your book, chapter 7, I think, was such an eye-opening read for me.
That's my favorite chapter.
Mine too.
I loved writing it. Forever, for your listeners, that's the chapter on medical history. And our history it's just been not a very unhappy relationship with the medical community historically.
Yes.
Aristotle called us leaky vessels because we cry and we menstruate. I mean, it just goes on and on and on.
I know. And I want to read this, what you say on page 136 about this, speaking about how this history is connected to how the history leads to the shame and guilt that we feel. You say, the shame that often accompanies illness can become so internalized that we tend to forget that the narrative is an imaginary one.
Right.
Instead, we nurture and feed it with self-doubt until it's so seamless, so much a part of us that we may not realize it's there. And shame is like garbage. It keeps piling up. It can pollute our decisions and taint them with our misperceptions about ourselves. We may end up making decisions that under different circumstances we may not have made, and which we might later regret. Oh my gosh, it literally taints how women see ourselves in the world, and it's not our story.
Right. It's just, do you remember, you're too young, you wouldn't remember the Gloria Steinem?
I do.
Just give me a kiss for those of you that don't know. But Gloria Steinem, it's in the book somewhere, wrote this wonderful thing of men could menstruate. I wish I could quote it better, but I can't. But basically, it would be when it would be a question of how much blood you menstruated, and I can't do it, but it's in the book and it's hilarious and it's so true.
Oh my goodness. So well, and I think we've got this thing going on where women go to the doctor and we essentially, quite often, I know I have had this happen to me several times personally, and I hear my patients, not a day that goes by in the office I don't have a patient tell me another story where they essentially get medically gaslit for going to get help for menopausal symptoms.
Yes.
And, we have to remember that, I know I'm using big words, but the truth is, medicine, the training of medicine has misogyny and paternalism baked right into it. And so much so that, many of us that have trained in those systems don't even see it until somebody else points it out to us. It's so baked in. And I think in a way, women are just showing up with the history, the baggage of all these hundreds of years of being told that we are less than, we are second-class citizens, we're leaky, we're, all of these things. I really enjoyed that leaky comment when you made it in the book, but it makes sense because, and I think the reason why I want us to discuss this is because I think when we can see it as a story that started before we did, we can see that it's not our baggage.
Right.
We don't put that on the backpack of all the other crap we're carrying around.
Right. Yeah, no, that's so true. But I think that, and I agree with everything you just said, but I think it's also important to be careful because while it's true that women do get gaslit, but that's actually a pejorative term. And there are some doctors that do. I mean, I've had my own experiences. But on the other hand, I think it's important that as women, we recognize that the medical community knows less about our bodies than they do about men's bodies. And there's some really good reasons for that. And let me just list them for a second, because I think it's important to get it. And the first thing is women were left out of clinical studies for years and years. Now it's much better now, but because women were omitted from these studies, we have no idea how women, for example, react to a heart attack or have what side effects they have to a particular medication. And as I said, it's better now, but we're still living with that history. And our diseases, because we get so many autoimmune diseases, they're much more difficult to diagnose. We have to remember, and when I shouldn't say remember because I didn't know this until I did the research, but there's about 20, 30, 40,000 diseases out there, and those are the ones we know about. And many of them share similar symptoms. So for the doctor, an accurate diagnosis can be like looking for a needle in a haystack. It can be a really tricky thing. And not only that, I mean, excuse me if I go on and on, but I think that doctors to a certain extent are getting a bad rep, and it isn't always true. But women's diseases get a lot less research money. Prostate cancer, for example, gets much more money for research than cervical cancer or uterine cancer or ovarian cancer. And those are much more fatal, but yet it's prostate cancer that gets the money. And also women researchers get published less often, and also are at the bottom of the funding barrel. They get less money, they are published less. So if you're a woman doctor or scientist researching a woman's disease, you are going to find yourself at the bottom of the barrel. And I think all of those are reasons that some of this, and now I'm doing air quotes, that some of this gaslighting exists. Although, as I said, I've had my own issues.
Absolutely. Absolutely.
I'm not saying it doesn't exist. I'm just trying to give a bigger picture for it.
Yes, absolutely. And fair. I mean, things are changing with medical training.
Yes.
But the reality is that once doctors are out of school and in practice, a good portion of their education comes from the pharmaceutical companies. So if there is not a pill for it, then you may or may not have it. So then the doctor, of course, not having had, and I'm talking GPs at this point or general practitioners, may have had very, very small amount of training in menopause. This is a podcast on menopause, so that's what we'll talk about here. But they have to have their own personal interest in it to seek out that training. Right. So I was reading yesterday that something 30% of Americans are somewhere in the menopause transition, and 90% of doctors have zero training on what to do.
Did you see there was a great article in the New York Times?
I did.
You saw that, dismissed.
Spectacular. Yep.
Spectacular. Absolutely.
Spectacular article. Yep. Yeah. Really good.
I'm glad you saw it.
I did.
For all of your listeners, do research it because it's fabulous. It's called Dismissed. I forgot the author or the reporter, and I should have it right here, but I don't.
Yes, you keep talking. I'll look it up.
I'm trying to. Well, I'll tell you a funny story talking about misunderstanding. It's in the history chapter, which, as I said, I had such a great time writing. But when, and many years ago, I don't know if it was not medieval times, I think it was Victorian times. Anyway, when a woman became menopausal, they thought that she would implode. She would sort of. Do you remember that? And there was this one poor woman, Cornelia Bandy, and they found bits and pieces of her all over, and they were sure it was menopause. I mean, I don't know what happened, but
it was spontaneous combustion, isn't that what you said?
Term. Thank you so much. Right.
I mean, 80% of us experience hot flashes. I'm sure that these women are feeling like, hey, we must explode at some point.
Isn't that hilarious? I know. Loved it. I just loved it.
So I posted the article is called "Women Have Been Misled About Menopause," and the writer is Susan Dominus. It was in the New York Times, and it is posted on my Instagram. For those of you that are watching, following me on Instagram, a couple weeks back, at Dr. Fiona Lovely is the Instagram. I'm so enjoying this conversation because, to me, Susan, I think the power, and I've always feel this way about when I'm creating content to share, is the power for us is when we can separate ourselves from the story that we've either been conditioned to believe, or we've somehow learned along the way from our experience. And so I think that's what's so powerful about Sidelined, your book, is that you actually say, okay, this is where this stuff is coming from. Now, take a step back and go, okay, how can I take better care of myself?
And I want to talk just for a minute. You gave me a wonderful lead in without even knowing it. Thank you so much. But I want to talk about second opinions, because I think that's perhaps the most important chapter in the book. Remember, as I was saying earlier, there's a lot of diseases out there, and a diagnosis is an interpretation. So, for example, there have been studies that the same symptoms can look like stomach problems to a gastroenterologist, stress to a psychologist. We see what we expect to see. So I think it's very important when your diagnosis or prescriptions treatment program is a serious one, you need to get a second opinion. And I think insurance pays for that. I'm not sure because I'm not an insurance person, but I think it's a very important thing to do. You don't want, women are misdiagnosed more than men are. There's about 12 million of us Americans that are misdiagnosed each year. It's one of the leading causes of death, and women are misdiagnosed more than men. So you really need to get a second opinion. And the second thing that I think is so important to do is get the clinical name of your disease, write it down, have the doctor write it down so that you can go home and hopefully you have a computer or your library does, and you can research the disease. Do my symptoms, does this feel right to me? Is this really what I'm experiencing? I think it's a very important thing to do, and especially with medication. Because there are side effects. I'll tell you a personal story of mine. It turned out to be an arthritic thumb, but I've never had pain. I'm one of those very lucky people. And all of a sudden my thumb began to hurt. So, because I've been writing this book, and of course I have every disease I read about, I was sure it was cancer of the thumb, just because that's who I am. All right, so I go to the hand doctor. And she says, no, it's just arthritis, took an x-ray and offered me some medication. And I said, great. And I'm on Lexapro for depression. So I said, does this medication interfere with Lexapro? And she said, no, absolutely not. So being the researcher and the neurotic person that I am, I went home and researched it. And she was mostly right. It doesn't, 99% of the time it doesn't. But that 1%, you can get a brain bleed. And I thought, I'm not risking it. If you're the 1% and I get a brain bleed because of a sore thumb, no way. The risk far outweighed the benefits. So I, threw the prescription away, and, my thumb turned out to be just fine. I got lucky. I got over it. But the point is, she didn't mention it, and I can understand why, because 99% of the time she would have been right, unless you're in the 1%. So I think it's really important to research your disease and your medication, your treatments, whatever. You want to know the benefits and risks of each procedure, medication, etc. So that's my do-good message for the day.
Your PSA, I dare say your book is full of them. But what you said about second opinions is so, so true. And I'm here in Canada. Some of my listeners here in Canada with me, or Australia or the UK. And we, in the socialized system, we tend not to ask for a second opinion. You're like, kind of like, oh, we're getting it for free. We're not really, we pay with our taxes, but it depends on your mindset about that. But we're getting this. So we first of all, you have to overcome all the reasons why women won't go and ask for help, but then you have to do it again and ask for, I would like a different opinion. And that feels confrontational to us, doesn't it?
Well, that's what's so interesting, is that women get second opinions less than men do. Men are better at this than we are. And almost every woman I talked to said, oh, I couldn't do that. I don't want to hurt the doctor's feelings. Or she is the professional. I'm not. I don't want to be rude. One woman said to me, I'll never get a second opinion. I'd be afraid that I would get a black mark against me in my chart, and it would follow me, throughout my career. We're socialized to play nice, and women feel that getting second opinions is not nice, disnice, unnice, whatever the word is. And truly, we really don't want to hurt anybody's feelings. And I think that is doing ourselves a serious disservice.
Oh, I absolutely agree. By the way, something you just said made me think of, early in the book, you talk about women not wanting to call for an ambulance because they're worried that their house is a mess.
Yes. I know. Could you imagine? So just so your listeners know, there was a study done. This was actually quite a while back, but nevertheless, researchers or somebody came in and asked women who had experienced heart attack symptoms how many of them would call 911. And only 50% said they would call for help. The other 50% said they wouldn't want the paramedics to see their messy house, and they didn't want to worry anyone. So
Yeah.
And just so everybody knows, when you have a heart attack, there's a window of about 4 hours you have to get some help, because you can do serious damage to your heart muscle after that. So you want to get help as quickly as possible. So, remember that, everybody, and don't worry about don't get out the vacuum. Just call 911.
Meet them on the driveway if you have to.
Right,
Like,
you
just
got it. Exactly. Exactly. No, absolutely.
on the front lawn, it's fine. It's soft.
Whatever it takes. Right.
Yes, 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 absolutely. Absolutely. So something else I would like to bring up that you mentioned in the book, page 66, I have written here, the doctor's bias, where you talk about the study, where I'm just going to read my notes here. If a woman was expressive, animated, and wearing bright colors, by the way, I'm wearing hot pink, Susan's wearing red, and jewelry, which we both have on,
Right.
she was more likely to be diagnosed as anxious, with panic attacks, even with a clear cardiac presentation, and the doctors were less likely to pursue a cardiac workup. That one actually stopped me in my tracks. I literally had to put the book down and think about, as myself, as a doctor, how do I see my patients coming in the office? How do I receive them? And where is that sort of baked in bias coming from? Because I didn't see it until then. So I'd love to talk about that.
Yeah, well, and there was another study which supplements or enhances the one you just mentioned, where a group of men and women patients had it was fictitious. They designed it, and they were given exactly the same symptoms. They all had the same risk for a cardiac event of some sort. And as soon as stress was mentioned, only 15% of the women were recommended to get a cardiac workup, whereas before stress, both the men and women were recommended equally for the cardiac workup. But as soon as stress was introduced, all the women were just only 15% of them did. I was horrified by that. And here's what you can do about that, because I think that is much more typical than it should be. Although, again, I think it's getting better. But when your doctor says your symptoms are due to stress, you want to say if you're in the emergency room, insist on an EKG. Don't let them send you home with antidepressants or whatever. And if the EKG is normal, that's terrific. And if it isn't, you got it. That's really an important thing. The other thing you always want to ask is, what else could this possibly be? So, you don't want to be confrontational. Yeah, it might be stress. What else could it be, do you think? And that hopefully will lead the doctor down a different path. And there's been some new research, which I just read yesterday, that women seem to do better, at least in the cardiology part of this, with a woman doctor. So if you're in emergency, for example, try to get a female doctor if you can. It isn't always true. My cardiologist happens to be a man, and he's just wonderful. So, I mean, it isn't a universal principle. But just the research does show that women do better with female doctors, at least for heart attacks.
And, that was a really interesting part of the book too, reading that as well. My husband and I have always been sort of amazed that our entire group of doctors, whether it's our GP or our dentist or our chiropractors, all female with the exception of one.
That's so interesting.
Yeah. So when I asked his opinion on it, he says, well, I feel so much better cared for, holistically cared for by my female practitioners than I ever did with before. And so, I do want to say things are changing with this, because the men are becoming aware. And I like to say, your generation and mine, we're not the ones to sit idly by and be quiet. Gen X is mine. So we're loud. If we have somebody tell us, we show up with symptoms and we're told we'll get used to it. This is aging, your tests are normal. Here's an antidepressant, all of that. We're more likely to stand up and say, to hell with that. I am not standing by. And I think that's part of the reason why we're really starting to see the needle move on this, why we're
Mhm.
starting to see this national press, not only that beautiful article in the New York Times, but there was one written in the Australian daily paper as well. I'm not sure which one. Pardon me for not knowing that, but we just, as I was saying to you, Susan, just this week, the Not Your Mother's Menopause podcast and my work in women's health is featured in the Globe and Mail here in Canada, which is our largest paper. And so we're starting to see that. We're starting to see that big press coming. And I think that's a really important thing. And I honestly think it's because my generation is not willing to sit by and say,
Yes.
oh, it's okay, you'll get over it. Don't talk about it. We'll sweep it under the rug. Whereas I remember my grandmother's generation, you definitely did not talk about hormonal issues. No way.
No, you're right. And incidentally, for everybody out there, I love being in menopause. Now I'm through it, but I absolutely, it's one of the best things that's ever happened to me. So there's light at the end of the tunnel. I didn't have many issues. My kids are having many more problems than I ever did. I did have hot flashes for a while, but for me, my periods were always irregular. So I could only count on them. They would always come when I would go on vacation or wear white pants. I mean, it was statistically improbable. There it was. So for me, not to have to worry and be able to plan a trip and actually, not be miserable on it. It's just the best thing that's ever happened. So there you go.
I've always said Mother Nature has a sense of humor. Like
Absolutely.
women, okay, it's been 6 months since I've had a period. Am I good? Do I not need to carry tampon? I'm like, are you out of your mind? That's like challenging the goddess. Don't do that.
That's right. But now I'm thrilled. And I'm still thrilled,
Yes. So tell me more about that. Tell me about the gifts of getting through that symptomatic phase of peri-menopause. What are the gifts? Please share.
Oh, I will. First of all, you don't have hot flashes. I'm 80 years old, so every now and then I will still get one, which surprises
me.
Okay,
if you guys cannot see Susan, you need to look her up because I'll have what she's having. She's not look 80 years old, but
are you nice? Now I'm throwing you a kiss. But I, as I said, I don't have to worry about a thing, and I mean that's really the benefit of it. It is when I would get my periods, because they were irregular, because they weren't every 4 weeks, they would be quite heavy. So I couldn't do this, I couldn't do that. I mean, it was awkward. And I used to, when we were in business, I'd sit in a conference room and hope to gosh that I wouldn't stain the chair. You can't get up in a room full of men with your butt all bloody, It was it's just wonderful. That's all I can say. If I could sell it, I would. It's great.
I hear that there's like a clarity that comes on the other side of all that hormonal dance.
Well, I never had the break. At least I don't recall having one podcast I was on. The doctor said, maybe you just don't remember. And, she may be absolutely right. But I don't recall having the brain fog at all. I really don't. But my hot flashes, I only lasted about 4 or 5 weeks. And they came right after my mother died. My mom died suddenly, and I stopped menstruating. I mean, there had to have been a connection. It was too odd. So I think mine was an unusual situation. But after it, I mean, once you're in menopause, I'm not unusual at all. It's fabulous. Just fabulous.
I love it. I look forward to that. I really do. And there's not enough women talking about what happens on the other side of this. And there's a lot of women who think that we're going to have these symptoms that we get in perimenopause for the rest of our lives, which can be up to 40% of our life, 40 or more percent of our lifetime.
Well, I'll tell you something really interesting. I had a chapter in the book, and it ended up on the cutting room floor on menopause. And as I said, I interviewed a bunch of people. So I tried to interview women about menopause. I had more trouble finding women to interview about menopause to tell me the difficulties of it than any other chapter in the book. Isn't that interesting? They all said, and these were random women. I mean, it wasn't anybody I knew, but well, yes, it was. Some of them were. whatever. But nevertheless, they all said that they thought it was a difficult time in life. One woman said something very insightful. She said, it's a difficult time in life for all of us, because it's generally when it comes about the time our kids leave home, our parents start to get older. And she said, it's hard to separate. She said, for her, it was hard to separate what was just, how did I call age trauma versus menopausal symptoms.
Wow.
But it was interesting. I really had a little bit of a problem. And usually people were more, I mean, I had more interviewees than I knew what to do with, generally speaking. So isn't that interesting? I mean, it sort of goes against what we're reading now.
That is fascinating.
I know. I thought so too. I did.
Fascinating.
Yeah.
Now, Susan, please pick up that chapter and write a book around it, because
I'm actually doing the second edition or a new book. I haven't decided yet. And it is going to be included. And the
Lovely.
Susan Thomas article, really spurred me. I thought to myself, I got to do this too. She's right.
Yes,
that's
please.
A great article, everybody.
And it seems like the best time to ask you, as the wise one in this conversation.
Love that.
It's true. Let's embrace it.
I do.
Let's embrace it, right? We've got this transition strip down the middle of our lives that we can call 1,000 different things: menopause, transition, perimenopause, whatever, midlife, all of those things. And then there's this other side that nobody talks about.
Right.
So, as the wise one in this conversation, what do you want us to know as the perimenopausal community? Again, what do you want us to know about what's coming? Maybe what advice you would give to your younger self?
Well, I think there's a couple of things not to know, but to realize. Let me put a different framework on it, because the symptoms, of course, obviously they pretty much go away, for sure. But it's a time of life. Let's say by the time your symptoms are over, you're 55, 60, 65. Your kids hopefully have left home or are settled in one form or another. Your parents are either doing okay or they're not. Life settles down. Each stage of life, and as I said, I'm 80, and I have found this even at 80. Each stage has its benefits and its not risk, because that's not the right word, but gains and losses. Can I put it that way? And life just settles down. It gets quieter. There's no teenagers in my house. My grandchildren come and then they go home, or when my kids come, it's wonderful. They come for dinner and we sit and we have a little cheese or a little hors d'oeuvre and a glass of wine, and then they go home. It's glorious in that sense. My house is clean. I'm take care of nobody but myself. My husband recently passed away, so I take care of nobody but myself. And I'm a, how do I say this? I'm a lover of narcissism, because it's just wonderful. I think about me, I worry about me, and I am my primary problem, joy, whatever you want to call it. And I think that all goes along with menopause, because it means we're getting older and things settle. There's no teenage angst in my house anymore. My kids will call up and they'll say, Mom, I've got this problem. And I go, gee, that's too bad. How are you going to handle that? And then I hang up the phone. It's glorious. So truly, it can be a lovely time in your life, particularly if you have your health and your kids are settled and all of that. Now, of course, you can be sick and in pain, and your kids can be a mess. I mean, we all have that too. But nevertheless, it's a very peaceful time in life. And I think that what's important, it can be a very peaceful time in life. And I'm one of the lucky ones, and I'm the first to admit it. But keep that in mind. There's a light at the end of the tunnel, or the rainbow, or whatever that expression is.
And there's so much. Yes, it did. And there's so much life after you stop having symptoms, right?
Look, I'm 80. I'm starting a second book. I just published my first one. I'm exercising. I'm having a dinner party Saturday night. I'm very much alive, It has nothing to do with age.
And do you think that, I'm interested to know what you attribute that to, and I see in you a deep purpose.
Thank you. I attribute it to really good luck, because I'm seriously healthy. I'm not sick. and I have really good genetics. Neither were my dad died of prostate cancer. That's not going to be my issue, Yeah, no, I have a lot of worries. That's not one of them. I think good genes, good luck, and I work at it. I have a very nice, mostly a good diet. I exercise 4 times a week. I do Pilates and I do weightlifting. In fact, you all should go to my website, grandma.gains, Gains. I'm sure I could bench press most of you. I can't open my own applesauce, but I'm terrific with the weights. I have to get one of those jar openers now that my husband's not here. Anyway, but I'm very strong. And I think that's important. I mean, I really do. And I think that's what I attribute it to: good luck, good genes, and hard work.
I'm so inspired by that. Thank you for sharing that. That's wonderful. But let me ask you, what information, what advice would you give your younger self, knowing what you know now?
I would tell myself to exercise even more, stop canceling. I really don't like it. And I work out with a trainer, but I do it. And I should have forced myself to do it even more, because then I would be even stronger. And I would watch my diet. I know more about food today than I did then. I'm not a vegetarian. I try, but I have cut down on beef, and I do eat some fish. And I try to have 1 or 2 my daughter's a vegetarian, so I'll eat there once or twice a week. And I call it my healthy night,
Yes.
But I think that I'm trying to think if there's anything else, because I didn't really find myself or know what I wanted to be when I grew up. Can I put it that way? Until I started writing this book. I'm a writer, and my husband and I were in the corporate training film business. We made films for business and industry. And although I wrote the scripts, I never considered this is just my personal journey, but I never considered myself a writer. I considered myself a businesswoman. It never occurred to me I was a writer until I started taking the anthropology classes, and UCLA was so impressed with my writing. They said, well, basically, why don't you write a book? And it had never occurred to me. So you just never know I think that's what I would say. You never know what's around the corner. You have to leave yourself open to opportunity. I mean, here I went to UCLA to go back and get a PhD in something. I didn't care what, but being retired didn't work for me. It was driving my family crazy. So I went back to school. And in fact, they said if I didn't go do something, they were going to shoot me. I was driving them nuts. So anyway, I went back to school and just took a bunch of classes, fell into anthropology. It fell into the book. You just, who would have thought that taking 1 or 2 classes would lead to a whole new career? At that point, I was 50 or 60. It's just, you never know what's around the corner, and you have to keep trying. Life has a lot of opportunities, and sometimes we don't see them. They're right in front of our face, and we may not see them. I mean, I wrote the scripts for years. Never occurred to me I was a writer. I didn't think of myself that way. Talk about, like we were talking earlier, about fictional narratives. The stories we tell ourselves are not necessarily the accurate ones or the permanent ones. They can be changed. Oh, that answered you better. That was a better answer. I like that.
But it was all good. It was all useful for us. And
good.
What's just struck me is that you call yourself a writer, which you didn't actually identify with until you were in your 60s.
Yeah, I'm thinking maybe mid 60s. How's that? I'm a late bloomer, let me tell you.
Yes, but fantastic, because many of us feel like our lives are essentially over, that we have not done the fun stuff, that we've spent all our time with this reproductive phase, and now we're in this symptomatic milieu that's not very nice, to be honest. So this is so inspiring. Thank you for sharing that.
Oh, you're so welcome. I just think it's so important to keep living and keep moving,
Oh, yes. Well, I have to say, I thoroughly enjoyed reading this book. The book is called Sidelined: How Women Manage and Mismanage Their Health by Susan Salenger. And I want to thank you for birthing this book, Susan, because you have brought to light some issues in women's health that we really weren't looking directly at. And you've written it in such a way it's accessible and that you've got these usable tidbits. And to botch a quote from Maya Angelou, when we know better, we do better. And I think
True.
this is important work. Thank you.
Oh, you're so welcome. And thank you for this wonderful conversation. I really enjoyed it. It was really fun. Thank you.
As did I. Susan, if people want to know more about you, where can they go to find out?
Well, in Canada, did you say it was Indigo? Yeah, Indigo has it in Canada. Amazon has it Amazon probably has it everywhere. It's actually worldwide, I think. And any bookstore. I mean, wherever books are sold is where you can find it, or they'll order it or whatever. And Salenger is spelled Salenger. It's an unusual spelling, but there it is. So I hope everybody enjoys it.
And you mentioned
one more thing. Can I say, I left out the most important thing. There's a resource list at the back of the book that is really invaluable. I have it organized by category. So when I said earlier, do your research, I've really done it for you. Go to the back of my book if you want to know how to check on your doctor's credentials or your hospital or whatever. It's all there for you. So that's really important. Okay, done.
Thank you for compiling that. I forgot to mention it too. It's excellent. It's an excellent, excellent resource. So thank you for bringing this information to women's health. And it's been a pleasure talking to you today. Thank you.
Thank you so much for having me. I really appreciate it.
The views and nutritional advice expressed by Dr. Fiona Lovely are not intended to be a substitute for conventional medical service. If you have or suspect that you have a medical problem, promptly contact your healthcare provider. No information offered here should be interpreted as a diagnosis of any disease, nor an attempt to treat or prevent or cure any disease or condition. As with any new advice or program, you should always contact your healthcare provider prior to starting anything new. Thank you.